Lawmakers are looking at Lyme disease, which has been affecting a growing number of people in Wisconsin.
Well, take a look at this. Wisconsin is one of 14 states where illness from deer ticks has been increasingly causing fever, fatigue, and worse. And political reporter Jessica Arp tells us why some believe there needs to be new medical standards for treating the disease.
You can tromp through the woods right now without the fear of ticks. But in the summer, ticks and the Lyme disease that some of them carry are a real concern. And those who have it say it's a medical navigation nightmare.
This is my crazy area of Lyme supplements.
Rob Tanner has a near stockpile of various drugs and supplements in his home.
I have a whole cupboard with probably at this point 20 different antibiotics that I've tried over time.
After 6 years of dealing with what he says is chronic Lyme disease, he says he went through 4 Madison doctors before getting a diagnosis in Fond du Lac.
Clindamycin.
And now he's treated by a New York doctor who specializes in Lyme.
But the reality is, unfortunately, I never would have even known I had Lyme if I'd have just trusted my doctors here, or certainly ever been treated with these more cutting-edge treatments.
Tanner believes the problem is education and lack of agreement on when and how to diagnose the tick-borne sickness, and then how to treat it.
I wasn't sure what was going on with my little boy.
Madison Democrat Melissa Sargent agrees her 10-year-old son Keenan was diagnosed with Lyme only after a medical struggle.
They didn't want to provide him a blood test, and I decided I was just going to sit him out in their office. Until we do this blood test, I don't think we're going to go home.
So she's teamed up with Republican Representative Dave Craig, whose close friend had Lyme, for a bill to require a state board to set guidelines for diagnosing and treating the disease.
Let's have an honest conversation about, one, the problem that our constituents are experiencing, and then also draw out the fact that the medical examining board should put together best practices for what physicians should be doing in our state and give some clear guidance.
But the Wisconsin Medical Society says that board's job is to investigate complaints, not to set medical treatment policy and law, which could change rapidly. Even Tanner admits the science can be murky.
We are in a time where, a doctor who isn't on one side of the debate or another can legitimately look at the science and say it's not clear. But I don't think science that's not clear is an excuse to kind of just stick with doing nothing.
The bill's author says it could get a hearing as early as next week. In Madison, Jessica Arp, WISC News 3.